To my students of final year, and at the beginning of my class, I pray to Almighty God for your healthy life and peaceful atmosphere so that you can continue your study and preparation for next final Prof exam. And we have already discussed the university question of medicine on cardiovascular system, respiratory system, and nervous system. And today we will discuss question about the infectious disease. And I will discuss 10 questions from infectious disease. Our first question is, a 40-year-old man came from Cox's Bazar, presented with the complaints of fever, headache, confusion, seizure, and coma without any localizing sign. What is your diagnosis? Our diagnosis is cerebral malaria. And our next question was, write down the investigation. First investigation is blood film, thick film to identify the malarial parasite, and thin film to identify species of malarial parasite. ICT for malarial antigen and hemoglobin percentage, which may be decreased due to hemolysis of RBC in cerebral malaria. And HGPT increase in case of hepatitis, and serum creatinine increase in AKI, and blood sugar hypoglycemia can occur in cerebral malaria. So these are the investigations we can do for this patient. Our next question was, give the outline of treatment. General measures of the cerebral malaria was catheterization to maintain intake output chart, and next oxygen inhalation to maintain oxygen saturation more than 95%, nasogastric feeding if needed to maintain calorie and body fluid, and maintain blood sugar and also serum creatinine. Specific treatment, injection quinine dihydrochloride, 20 mg per kg body weight in 25% glucose, 100 ml over 2 hours stat. Then 10 mg per kg in 25% glucose, 100 ml over 2 hours, 8 hourly for 5 days. Or injection artesunate 2.4 mg per kg body weight daily for 7 days. So our next question was, define PEO. And regarding PEO, maybe it may be defined as the persistent fever having temperature more than 100.4 degree Fahrenheit for more than 3 weeks, and no cause is detected after 3 days indoor investigation or 2 outdoor visits. Now, what are the causes of PEO? Regarding infectious disease, chronic malaria, kala-jar, urinary tract infection, and lung abscess. And regarding the chronic tissue disease, rheumatoid arthritis, SLE, and stale disease. And regarding the malignant disease, leukemia and lymphoma. Third question was, what are the clues for diagnosis of factitious fever? The first criteria of factitious fever, patient looks well. Body temperature always 104 degree Fahrenheit. and Bijari temperature chart without diurnal variation. Normal ESR and CRP despite high fever. Absence of sweating during defervescence, and normal temperature during supervision. So these are the 6 criteria for diagnosis of factitious fever. Our third question was, a 30 years old man hailing from Dinajpur admitted to hospital with the complaints of swelling of both legs and scrotum for 2 months. On examination, there is non-pitting edema. What is your diagnosis? Our diagnosis is filariasis. And next question was, write down the investigation to reach the diagnosis. Among the investigation, blood eosinophilia, total circulating eosinophil may be 1000 to 5000 per cubic millimeter of blood. Microfilaria may be seen in blood film under microscope taken at night. And ICT for filarial antigen positive, it is highly sensitive investigation. And CFT for filaria is positive, but this test is nowadays in practice. PCR, a recently introduced investigation to detect microfilarial DNA, and ELISA to detect antibody. Now, how we can treat filaria? It is treated by diethyl carbamazepine 2 mg per kg per day in 3 divided days for 12 days. But if lymphedema developed, then tight bandage and massage bed rest with elevation of the affected limb, and occasionally plastic surgery may be needed. Now question number 4. An adult male presented with generalized rash and malaise. Generalized rash and malaise. He gave also history of fever and severe headache. What is your provisional diagnosis? Our provisional diagnosis is dengue. There is some printing mistake. Generalized rash with malaise, not, it is your melena and melena. So we can make a diagnosis of dengue hemorrhagic fever. Generalized rash with melena, and he gave also history of fever with severe headache for 2 days. And then our diagnosis is dengue hemorrhagic fever. And next question was, mention 4 important causes of fever with rash. The causes of rash are measles, dengue fever, scarlet fever, typhus fever. These are the diseases causing fever with rash. And 4 antiviral drugs, acyclovir, lamivudine, entecavir, and adifovir. These are the commonly used antiviral drugs. Question number 5. Write down the features of Kala-Jor. The features, commonest presentation of Kala-Jor is fever, which is prolonged fever and intermittent type, biquotidian in nature. Appetite is good. Splenomegaly may be massive, develop quickly. Hepatomegaly occurs later. And black discoloration of the skin can also occur. And patient may have severe anemia and bleeding through nose and GIT due to thrombocytopenia, and a circa due to hypoalbuminemia. Now investigations. What are the investigation we should do for collagen? And blood test. Anemia, leukopenia, thrombocytopenia occurs in collagen. Direct agglutination test. This is a very cheap and available test. ICT for Leishmanian antigen. Spleen smear for determination of your hemastigot form of Leishmania donovani. Bone marrow aspiration also shows hemastigot form of LD bodies. Immunofluorescence test to detect antibody. PCR nowadays introduced to detect DNA. Serum bilirubin may be increased in jaundice person, and X-ray test to detect secondary bacterial infection and tuberculosis. Now treatment of collagen. Injection sodium istugluconate 20 mg per kg per day for 28 days. This is the parenteral drug, and nowadays oral drug is introduced, that is multifocin 100 mg daily for 28 days. And for relapse case of collagen, it is treated by injection of potassium B 0.5 to 1 mg per kg body weight IV on alternate day for 20 days. Now, what are the complications of collagen? Complication of collagen are pancytopenia, bronchopneumonia, pulmonary tuberculosis, gastroenteritis, hepatitis, chronic liver disease, skin infection like boil cellulitis, and hyperpigmentation of the skin, and PKDL also. Now question number 6. A patient presented to you with thickened earlobe, loss of eyebrow, and multiple punch-out anesthetic lesion over the whole body. What is your diagnosis? My diagnosis is leprosy. Write down the checklist of clinical findings in favor of your diagnosis. The skin change in leprosy are hypopigmented anesthetic patch, symmetrical distribution, and it is papular and maybe nodular also. And facial change in leprosy are loss of eyelash in the lateral eyebrow, thickening of the skin of the face, giving the appearance of leonine faces. And peripheral nerves, great auricular nerve, facial nerve, radial nerve, ulnar nerve, median nerve, common peroneal nerve. These are the spinal nerves, and the cranial nerves are involved in case of leprosy. Now the complications, what are the complications of leprosy? Peripheral neuropathy, blindness, nasal collapse, orchitis, sterility. Now, what are the specific investigation for leprosy? Slate skin smeared of skin by skin scraping. Slate skin smeared by skin scraping from the affected area, and Jill Nelson media staining, and AFB seen under microscope to confirm the diagnosis of leprosy. Now question number 7. A 25 years old man working in a hotel of Foxbayard presented with the genital ulcer and inguinal lymphadenopathy. Mention 4 important differential diagnoses with causative organism. The differential diagnoses are lymphogranuloma venereum, and it is caused by chlamydia. There is some spelling mistake. Lymphogranuloma venereum and it is caused by chlamydia. Second disease is chancroid, which is caused by Haemophilus ducrei. Third is Klebsiella granulomatis, which is caused by Granuloma inguinale, and fourth disease is syphilis, which is caused by Treponema pallidum. So these are the four diseases causing by fourth organism. Now, what are the investigation we can do for this patient diagnosis? For chlamydia, NET test should be done, nucleic acid amplification test. And for chancroid, we can do microscopic examination from scraping from the ulcer. For Klebsiella granulomatis, we can do microscopic examination of the cellular material from the scraping. And for syphilis, non-specific test BDRL, and for specific test, enzyme immunoassay, TPHA, and TPI. These are the investigations for syphilis. And regarding counseling of this patient, we should advise the patient to avoid multiple sex partners, use condom, and avoid unprotected sex. Now the question number 8. A 30-year-old man presented with high fever for 5 days, followed by unconsciousness. His GCS was 7 and he was ecteric, mildly anemic, temperature 102 degree Fahrenheit. Tell 3 differential diagnoses of this patient. And the disease are dengue hemorrhagic fever, leptospirosis, and cerebral malaria. Now, what are the investigation we can do for this patient? And for dengue, we can do blood test, which will show leukopenia, thrombocytopenia, and hematocrit will be increased. For detection of the dengue antigen by PCR, and detection of the dengue antibody by ELISA test, and HGPT2C hepatitis. For leptospirosis, urine for microscopic examination to detect leptospira in second week, blood culture within 10 days of disease, PCR to detect DNA of the leptospira, and microscopic agglutination test is also available. Regarding the treatment of cerebral malaria, for cerebral malaria investigation, thick and thin film, ICT for malarial antigen, hemoglobin estimation, HGPT, and serum creatinine should be done. And treatment for leptospirosis, capsule doxycycline, 10 mg 12 hourly. And for dengue, bed rest, paracetamol, blood transfusion if severe thrombocytopenia developed. And for cerebral malaria, quinine dihydrochloride should be given for treatment. Now question number 9. A middle-aged married woman present with vaginal discharge and dyspareunia for a week. Write 4 differential diagnoses. And the differential diagnoses are gonococcal infection, chlamydial infection, trichomoniasis, vaginal candidiasis, and bacterial vaginosis. Regarding the investigation of this patient for gonorrhea, microscopic examination of vaginal swab for gram-negative diplococci, for chlamydia, NAT test, for trichomoniasis, vaginal swab for microscopic examination, which will show flagellate pathogens, and vaginal candidiasis, vaginal swab microscopic examination show fungal spore. Now treatment for gonorrhea, injection ceftriaxone 500 mg IM stat or tablet ciprofloxacin 500 milligrams single dose. For chlamydia, doxycycline 100 milligram 12 hourly for 7 days. For trichomoniasis, metronidazole 400 milligram twice daily for 5 days. For vaginal candidiasis, pressure, iconazole pressure 150 milligram once daily for 21 days. For bacterial vaginosis, tablet metronidazole 400 milligram twice daily for 5 days. Now the last question. A 50-year-old man admitted with 3 months low-grade fever, chronic diarrhea, and ascites. And what is your likely diagnosis? My diagnosis, most likely abdominal TB. And name 6 investigation with findings. First, blood ESR which will be increased, tuberculin test will be positive, and X-ray chest will show patchy opacity in lung due to TB. And fourth investigation, ascitic fluid analysis, color is straw color, cytology, lymphocyte, and predominant, biochemical protein increased and glucose decreased. And colonoscopy which will show ulcer in colon. Biopsy can be taken from the ulcer which will show granulomatous lesion. An ultrasonography of the whole abdomen which will show enlarged para-aortic lymph nodes. Now treatment, and for TB it is treated by anti-TB drugs category 1, first 2 months 4 drugs, and next 4 months 2 drugs, rifampicin and INH. And general measures for ascites, salt restriction, furosemide, aspiration of the ascitic fluid. For diarrhea, colloidal saline ORS. And this is the end of today's class. So I hope that my student will take note from this discussion, and they will read at least this 10 question about the infectious disease. And today we have completed total 40 question for written, and we will try to continue this session. And other teachers, especially Dr. Ganesh, is taking class for OSPI, and Professor Dilip Kumar Roy is also taking class about the OSPI. And after completion of the OSPI, we will go through Viva question, discussion about the Viva question. And our 3 teachers of medicine department will continue the class till the college opens. So I again hope good health and good peaceful life for my student, and pray to Almighty God for their healthy life and peaceful life, so that they continue their study. So thank you all. Thank you all.
Thank you, sir.